Hi, this is Scott Nichols, president of MyMedicareQuestion.com and the MMQ app. We are a proud facilitator of the Medicare Minute, brought to you by the Medicare Rights Center. Here's this month's Medicare benefit information. Part B and Part D prescription drug coverage. This month, we will learn some of Medicare's rules for coverage of prescription drugs. Understanding when Medicare Parts A, B, and D cover prescription drugs. Part A covers the drugs you need during a Medicare-covered stay in a hospital or skilled nursing facility. Part B covers most drugs administered by your provider or at a dialysis facility, but the provider or facility must buy and supply the drugs. Part B also covers some outpatient prescription drugs, mainly certain oral cancer medications, chemotherapy. Outpatient drugs previously paid for by Part B will continue to be paid for by Part B. Part D cannot pay for any of your drugs that are covered by Part B. Part D covers most outpatient prescription drugs, drugs you fill at the pharmacy. Check your plan's list of covered drugs, known as a formulary, to find out whether it covers the drugs you need. Understand the circumstances when certain drugs are covered by Part B or Part D. There are several drugs that may be covered by Part B or Part D, depending on what they are used for and how or where they are administered. Some of these drugs include injectable drugs. Part B covers injectable drugs if you usually cannot administer the drug yourself and your doctor provides and administers it to you. Part D generally covers injectable drugs that you buy at the pharmacy, whether a doctor administers the drug to you or you administer it to yourself. Vaccines. Most vaccines that your doctor recommends you to get are covered by Part D. However, there are certain vaccines that are always covered by Part B. Influenza flu shots, pneumonia shots, and hepatitis B shots for people who are at a medium or high risk of contracting hepatitis B. Part B also covers vaccines after you have been exposed to a dangerous virus or disease, such as tetanus. Insulin. Part D covers insulin and related medical supplies used to inject insulin. That'd be syringes, gauze, and alcohol swabs if you self-inject insulin. Part B may cover insulin that you use with an insulin pump, insulin pumps, related supplies, and the insulin used with these pumps are covered as durable medical equipment, or DME, if you meet Medicare's coverage criteria. Immunosuppressants. Part B covers your immunosuppressants if you received your transplant in a Medicare-approved facility and you had Medicare Part A at the time of your transplant. Part D covers immunosuppressants if you did not have Part A at the time of your transplant or you did not have your transplant in a Medicare-approved facility. Know what to do if your drugs are being billed to the wrong part of Medicare. If you believe that your provider is having trouble billing correctly, or if your coverage of your medication is being denied because the medication was billed to the wrong part of Medicare, ask your provider or pharmacist to submit the claim to the correct part of Medicare. If you have questions about how to submit these claims, ask them to reach out to your plan or to the Medicare Administrative Contractor for original Medicare Part A or B claims for assistance. Remember, if payment to your medication is denied by original Medicare or your Medicare Advantage or Part D plan, you have the right to appeal the denial. Ask your doctor for their help providing Medicare to your plan with information needed to successfully appeal. To take action, call 1-800-MEDICARE for help understanding the cost and coverage rules for Part B drugs if you have original Medicare. If you have Medicare Advantage, call your plan for this information. Contact your Part D plan for information about the cost and coverage rules for Part D drugs. Contact your State Health Insurance Assistance Program, SHIP, if you need help appealing a drug denial. To contact your SHIP, Call 877-839-2675 or visit www.shiptacenter.org. As always, remember, there are great educational videos on your Medicare benefits at mymedicarequestion.com and the MMQ app. And remember, share that MMQ app with a friend. It's free.